Welcome back. You're still watching SA Today, and particularly in this hour we've been focusing especially on the coronavirus. China, of course, is the epicenter of this, but we've started to see spreads in other parts of the world, mostly in the east, but there have been cases that have been reported, and one country is the United States of America, where authorities there in Texas are investigating what they believe could be a second suspected case on U.S. soil of the deadly Chinese virus, namely a college student who'd recently returned from the city at the heart of the outbreak, Wuhan. Well, we cross now to our correspondent in Washington, Nick Harper. Nick, thanks very much indeed for joining us. So what is the situation in the United States in terms of confirmed cases and people being monitored?
Well, in terms of those cases, we have that confirmed case, which was the first case in Everett, Washington state, so over in the northwest of the country. Now, that man, a 30-year-old man, had been visiting Wuhan. He returned, showed symptoms, and it was confirmed that he had coronavirus. Since then, he's been in an isolation unit in hospital, being monitored very closely, but also having very little contact with people, with doctors in the centre. We're told that he's mainly receiving care from a robot that has a stethoscope who can monitor his vitals, and he also, through the robot, has the ability to speak to real-life doctors who physically are not present in the room to make sure that they don't catch the disease as well. And yes, also this suspected case, potentially the second case in the US, down in the US state of Texas. This is a student who goes to university there. It seems to be showing signs after a recent trip to China. He isn't being treated in hospital, but has been isolated at home. And also, the US authorities are just being careful to make sure that both the suspected case and the confirmed case isn't spreading further. For example, in Washington state, where that case is confirmed, they are now monitoring closely 43 other people who came into contact with that 30-year-old man with the confirmed case, making sure that they don't show any symptoms that become very clear that they have it. So keeping a careful eye on what is happening to those people in those states and making sure it doesn't spread.
So in situations like this, the Centers for Disease Control and Prevention, the CDC, normally sort of goes into action. And I wonder, what have they been saying and what sort of interventions have come into play already?
Well, the CDC very quickly went into action with what they were saying. They just don't seem to have quite followed through on some of their promises. Initially, they were saying that what they would do is create special screening hubs at airports across the US. Initially, they had San Francisco, LA, New York on the list. They also added to that Atlanta and Chicago. Those are the big airport hubs around the country. And the idea was to funnel any incoming flights from China, to reroute them to one of those 5 centres where the passengers could be screened, so they could be monitored as they came off the flight. They could have their temperatures taken. But we're being told that even though that this plan was announced several days ago, they are not quite at the point where they are trying to reroute these flights to funnel them and assess all of the people coming off of those planes. But of course, with Wuhan and many other cities are in that region now on lockdown, with no way for the people there to travel outside of their cities, it does seem as if it will be slightly harder for the disease to be transmitted via passengers who are getting on planes. But there is a concern, of course, that perhaps before that lockdown took place, that there were some people within China who were able to travel to other cities and catch flights to the US. So the CDC has come out with that list of precautions. They just don't seem to be fully in place just yet.
What's been the public response in the United States? Has there been some kind of panic growing, or things still relatively, I don't know, I suppose still taking in the information?
I think people here, Peter, are still taking stock of the situation. There doesn't seem to be widespread panic, but of course people are concerned because it is a heavy commercial plane route between China and the US, especially at this time around Lunar New Year. We have a lot of people coming from China to visit relatives within the US, so the timing of this, with many people travelling, is of concern. I think with the CDC trying to put those measures in place, it has helped to alleviate some fears, but we have seen an uptick panic of the purchasing of face masks on US Amazon sites. So we are seeing people perhaps stockpiling them in preparation. There was much more widespread, almost panic, in years gone by when we saw other widespread diseases like SARS, like swine flu, even a couple of years ago with Ebola coming to the United States. At the moment, I think panic levels are very low, but the potential is that if we have more cases confirmed on US soil, then that fear, that anxiety will certainly grow across the whole of America.
Any word as yet about, I don't know, drug companies, scientists working already to try and find a vaccine?
Well, they're certainly working on it, and there are different places around the world who are attempting to achieve that. Here in the US, in Washington, D.C., the National Institutes for Health are working on it. However, it is a slow process. I've been in contact with them, and they say that they are in the early stages of working on a vaccine. However, it will still be a couple of months before they get to even the clinical trial phase. And to be able to produce an actual vaccine that people can actually use could be as far as a year away. So there is work underway, but it will take some time before we get to the actual point where there is that medicine, that drug that people can take to make sure that they either don't get it or, if they have contracted it, are able to get over it much quicker.
All right, and then perhaps finally, the one case that has been confirmed, do we know how the person is doing at this stage? And I would imagine that he's heavily quarantined.
He is absolutely kept within an isolated unit in the city of Everett in Washington state, just north of Seattle. And I think they are trying to very much limit any kind of contact that he has. So if he is coming into contact with doctors and nurses, there's only a few of them. And it's mainly that care through the robot that seems to be the way that they are choosing, just to make sure that he doesn't pass that on to anyone else. But of course, he did come into contact with people before he was admitted into hospital. Those close contacts, we're not told exactly who they are, but they're likely to be family members if he's got them here in the US, but also friends, perhaps colleagues. Those are the 43 people who are being monitored. So certainly keeping a very close eye on the situation, and we're not being told exactly the status of the patient, that 30-year-old man, but we are told that they are monitoring, helping him as much as they can, and making sure that they're limiting the ability for that virus to spread further.
All right, Nick Harper, that's where we'll leave it. Thanks very much indeed. That's our correspondent speaking to us from Washington.